Emile, thank you so much for being here.
It's my pleasure. Thank you for having me.
Emile, you interned at big banks, Deloitte, and then a couple of years later, you start a health tech company. How did that happen, and how did you get into the field?
That's a great question. Wow, you're taking me back a couple of years. Really, what happened was I was working in corporate and I didn't like it. I started looking for, a startup environment, something where I could be more hands-on. My first gig started off with a carpooling application here in Canada, and shortly after that, I met my CEO, who we found commonalities where we both had tremors in our families. And when we started exploring the market further, we realized that the solutions that were available in the market, they didn't really meet the needs. So we decided to build the solution ourselves and stumbled upon a market that was discombobulated, requiring more attention and more solutions. So my CEO was he comes from an engineering background, a structural engineering background. So we took an idea of tune mass damping and decided to miniaturize it and magnetize it so we could accommodate a wider range of frequencies, and we ran with it.
Emile, how did you know that it was the right thing to partner up with your co-founder?
Yeah. Funny enough, we after we met in a short period of time, we found out that our families had worked together in the past in a different place. Uh,
Wow.
yeah, it was a nice coincidence. But we kind of approached it with the mindset of, I'll handle the business, he'll handle the product, and we ran with it. We went through a couple of incubators, learned what we needed to learn. Of course, you can't learn everything as a first-time founder. They will make mistakes, but it was a pleasure to make those mistakes along the way with my CEO.
So you're currently the CMO in the company?
I'm the chief marketing officer. You wear a lot of different hats. I would say like he covers the CEO, CTO. I'd be like a COO, CMO. We have a CFO now. Before I was also wearing that hat. But yeah,
So you said that you didn't find anything in the market. So what happened? You all have someone in your families that has tremors and they didn't have any solution. So you looked for solutions and nothing was there, or the solutions weren't on par with your expectations.
the solutions were not on par with our expectations. For example, medication only works for around 40% of the population. And surgery is, very expensive, very intrusive, bloated with side effects. So we decided to take an approach that was kind of external, non-intrusive, something that we could be proud of and with a high efficacy, and something that was affordable.
I'm gonna jump straight into the product.
Sure.
The website says the flagship product, the Steady 2, is a battery-free glove that is designed to intelligently stabilize wrist tremors. So a lot of questions. First of
Yeah.
all, why is it important for it to be battery-free?
Um, because you can allow for unlimited usage. It also becomes a different category of risk when you're dealing with regulatory affairs. And because we're able to boast a high efficacy with a proprietary technology that we've invented.
How do you build something like this? I mean, like, I think he has an engineering background, and you don't have a medical background, do you?
No,
S- So, how do you end up building a product like this one? Is it like constant A/B testing, a great team? How'd you do it?
yeah, we united a bunch of people that all have tremors in their families. So they had this empathy towards the product that we were building. And we were able to fortunately partner up with tremor organizations to to test out what would work, to test out what the price points would be what they would be most comfortable with for pricing, things like that. Along the way, there was a lot of back and forth. We're actually on our third iteration of the technology now, which we launched for pre-orders around 6 months ago, and we're happily delivering on in 30 days.
Wow. And you talked about regulation. So do you need any kind of regulatory approvals if it's not a drug, if it's just a tool, if it's just
Absolutely. Yeah. Because of the claims we're making, we still need to be a medical device, a registered medical device. So with the FDA, with Health Canada, we're registered as a class one medical device. In any other jurisdiction where we sell, the distributor would typically go after the registration process, and it would typically be a class one device, except in Europe, it's a class 1A, which just means a little bit more red tape, but a, qu- you know, less complicated than an intrusive product or a battery powered product.
is that kind of like the reason why you did what you could to not have the battery? Is because
Well,
it's easier to sell?
I think it was that, and also the fact that it offered unlimited usage, instant feedback, right? Like you could be in a situation where you have a battery powered device but it hasn't been charged, or you need it for an extended period of time because your job requires you to have these stable hands and your hands are shaking all the time. So with our solution, you're able to slide it on immediately and see the results.
And so how does it work?
um, we derived the technology from a technology called tune mass damping, where maybe you've seen those buildings that shake with an earthquake, creating a counteracting force. What we did is we added a magnetic component to this technology to create a magnetic tune mass damper that counteracts your tremors in six different directions. So we're able to pretty effectively reduce the tremors without any batteries using this magnetic tune mass damping system.
And that's amazing. I mean, the because everyone knows about the buildings and how they're constructed to survive earthquakes. And then when you think about it, it is kind of the same thing. It's
Yeah,
just it's unbelievable how you made the connection between both. And so,
yeah.
how do you test this product? Do you just get people with tremors to just try different devices and see which one works, which one doesn't work, their feedback?
That was the hard part, actually. First initially we started by testing on something that we built in-house. We built a rig that simulates tremors, and we would put these different stabilizers on the rig. It was like a mechanical hand, and we would identify, which simulation was the best one, and then take it out of the lab and go do these live tests with maybe sometimes physician supervision and a patient, or we would meet patients in different support group settings, or stumble upon, like in some cases, stumble upon somebody who has tremors in real life, like at an airport lounge or at the supermarket, and be like, hey, I have this device in my bag. You want to try it?
Wait, did that actually happen? Did you actually?
Absolutely. Everything I just listed happened.
Wow.
Yeah.
And so what kind of reactions did you get from people? Because I feel like this is a an aha moment for people who suffer from this for a while. Because if I've been suffering from tremors for 10 years, at some point I'll just give up on it and I'll just get used to it if nobody's ever
That
approached me.
that's exactly what's happening today. I think the statistics in the United States are there are around 7 to 10 million people with tremors, but only 1.5 million of them are in the healthcare system, which is a big indicator of the fact that a lot of them have either given up or rejected what their physician has tried to say to them. Um, so definitely been a challenge. The main feedback that we get is, you know, can you make it smaller, lighter, more effective for me? But on the other side of the spectrum, you also have, like you said, these aha moments where you have patients that, for the first time in 30 years, they're able to apply makeup on their face. They're able to shave their own beard, dress themselves, eat, drink, write. Revolutionary progress in their day-to-day activities that increases their independence and confidence.
Do you feel that there was a lack of awareness on the subject? Because
There still is.
tremors is not a rare
Yeah,
case. I mean, I have it in my family as well. I mean,
absolutely.
it's everywhere. So why do you think
Yeah,
it's been neglected for so long?
because the solutions were not. I'll give you an example. In the medication realm, the medication that's typically prescribed for people who have tremors, let's take essential tremor as the example. They're anticonvulsants. They're made for people who have seizures. right? So they're not really designed to actually tackle the tremor. They're meant to tackle seizures, and as a result, their efficacy is bulleted with side effects and not effective.
And where are the markets where you've seen the most traction? Are you selling it everywhere? Are you focused on a specific area?
Naturally, being based in Canada, we went down south because the market is a little bit larger, a lot larger, and we've identified certain reimbursement pathways that have made adoption a lot faster. For example, if you're a veteran in the U.S. Army, your device is fully covered. Soon in a year or so, we anticipate that our device will also have Medicare coverage, which means that the out-of-pocket costs will be a lot lower. Um, and hopefully we can do the same in other jurisdictions. But primarily we went after the US. We met a couple of different contacts in different jurisdictions like Japan, Australia, South Korea, which we're very excited to partner up with too. But primarily I would say around over 80% of our sales come from the United States right now.
I mean, in your position, there are so many things to work on. I mean, first, you got the new markets. There's optimizing the product itself. Like you said, the feedback, making it smaller or whatever else people are saying. And then, man, what are you focused on right now? Because there's so much demand, and if I'm gonna be honest with you, like a couple of months ago, I've never heard of you. But
Yeah, of course.
like now that I see what you're doing, and I see that the technology it's so straightforward and can be so helpful, that there's so many people that would just probably want to try it if they knew about it. So how are you raising awareness about the
And that's
filter?
exactly what we're doing. We're raising awareness. What we're rolling out in July is the opportunity for patients to demonstrate the technology in different clinics. So what we're doing from now until then is trying to hit as many doctors and as many clinicians as possible to deploy demonstration kits for free in their clinics. We now have around 17 sites in Canada, all the major hospitals across the country. We are working with them in some capacities. We'll be rolling out this program in July. In the US, we have another 60 or 80 different sites that are also hoping to capture our device and demonstrate it with patients in the near future. And on my job right now, that's my main target is to raise more awareness by attending different, movement disorder focused conferences that I could meet more physicians in and tell them about our solution. Because today, if you have a tremor, you're not going on Google and typing in glove for tremors. It's unlikely. You probably don't know that there's a glove for tremors. What's working for us is there are some awareness on weighted gloves as a solution, and then we try to parlay on that.
Are you on the ground visiting those locations? Do people need to actually be trained, or is it very straightforward? You get it and you can immediately start using it.
It's a great question. So yeah, the offer is there. What we try to do is try to keep it as virtual as possible. We send them the demonstration kit. Our instruction video is like 90 seconds long. If you still have trouble, we're more than happy to hop on a call. And if what we try to do is try every time we go to a different conference, we hit up the local clinics that are in that area and try to arrange for a in-person meeting if possible or if needed.
I mean, it's always been a decade. What has been the most challenging part of this journey?
I think developing the first device was the most challenging part. It took us 5 years to get to market with that one. We really accelerated the process after that. Um, Product market fit was a challenge because customer acquisition cost was so high. That was a really big pain for us. Now we're reaping the rewards of early stage product market fit. And I think the biggest challenge has always been the same. Funding for a pure hardware solution in an AI world has always been a challenge. But we've navigated that successfully. We're very fortunate, and a big shout out to all of our early stage investors for trusting us and believing in us.
You mentioned AI, so I have to ask, how do you think this transformation in the tech world could impact hardware, like the products that you are selling?
Yeah, I think you'll see a lot of patient monitoring, a lot of early diagnosis, integrated into some wearables, which will help improve the outcomes of their day-to-day activities in the future. That would be like the first immediate response I have.
Do you feel like this is something on your radar right now, or there's just way too much that you need to deal with before?
Um, Definitely it's on our radar. I would say that we would have to study how to implement it successfully and to avoid deviating from the low-hanging fruit that we're on track for. But definitely it's on our radar.
Emile, it seems like you're giving back to the community in the past year. I don't know, something's happening. You're a business mentor, you're a volunteer judge, you're a startup mentor. What's been going on? Like, all of these are like these new side quests that you have. Why are you doing all
Yeah.
this?
Um, because I do think that for the first time during the startup journey, there's really a lot of support for disability, for aging technology, for these new subsections of med tech that didn't exist before. And, as you mentioned, we're approaching year 10 in the company. If I would love to share the lessons I've learned and, you know, provide shortcuts to the up and coming founders that are working in these spaces. So that's my way of giving back. And, I finished off an MBA recently too. So throughout that time, I learned how to optimize my schedule, better plan, and I've freed up more time for mentoring.
Emile, since you're a mentor today, did you have a mentor back then, 10 years ago?
Yeah, yeah,
Yeah.
we've had multiple mentors along the journey. Some of them joined our team, became the chairman of our board. Some of them are have equity stakes in the company now. I really do think that mentoring and advisory can take your company to another level if you choose them right, or if you choose to listen to the advice. Don't get me wrong. Everyone's going to try to pull you in their different bias and try to deviate you from your focus. But if you find the right mentor, they will help you nurture your focus. They'll help you build on that pipeline and successfully achieve your goals.
How did you build your team? Is it people are all passionate about the subject, or they're just expert in the certain field, or is it both?
It's a little bit of both for sure. The experts in the field came from the engineering world through fantastic programs like the Canadian MyTax Accelerate program, where we were able to, you know, uh, work with a PhD at a discounted price and then offer them a job in the future. Before that, there were a lot of contractors, either through the grapevine of networking or through referrals from other hardware startups in the ecosystem. But definitely, we do the best we can to try to make sure that everybody on our team has a certain level of empathy towards the problem we're trying to solve. Because at the end of the day, we're working on improving the quality of life and independence of people with hand tremors. So they need to really understand the problem.
You got funded, and it's not something that you can just learn on the internet. How how did you navigate that? And was it a lot of back and forth? Because we hear a lot of these horror stories from companies. They try, they fail, they give up, they try again. How were you able to do this? Was it a mentor? Did someone assist you in this journey? How did you do it?
We became masters at non-dilutive funding applications. And then we became masters at pitching. Along the way, of course, we had to identify the different investors that would be, even interested in funding our journey. It's definitely comparable to speed dating. You must have heard this before.
Is it a two-way street? Do you pick your investor and they pick you? Should both of you be happy, or do you just take money from whoever?
No, in the beginning, we thought that taking money from whoever was the right way to go about it. But actually, because of the different applications that we were submitting, we ended up taking money from people that are more relatable to our space, like I don't know, like Ontario Brain Institute, like the Center for Aging and Brain Health Innovation at Baycrest Hospital in Toronto, like the Age Well Network Centers of Excellence here in Canada. Like one more, I would say,
Mhm.
like Halo Health, the network of angel physicians in Canada.
Emile, I'm going to end with this. What is the next big milestone for Steadyware?
The biggest milestone for us is closing our seed round. We're getting close there, and product delivery next month. Those are the main two direct milestones that we are aiming to achieve. The longer stage milestones, hoping to get the device covered by Medicare by the end of this year, or sorry, in a year. And that's really where we think that we can provide the most value for both of our shareholders and every stakeholder involved.
Emile, I think it's amazing what you guys are doing. Thank you so much for taking the time.
I appreciate it. Thanks for having me.